The CSR payments has actually brought Republicans and Democrats together because we got calls, emergency calls from the Democrats, and I think probably the Republicans were also calling them, saying, let's come up with at least a short-term fix.
Welcome back. That was President Trump today, showing some optimism for a deal on health care involving both Republicans and Democrats. At the end of last week, the White House announced it was ending Obamacare subsidies that help lower the cost of insurance premiums for lower-income Americans. Those payments are called CSRs, and the president says they're a, quote, payoff to insurance companies. It seems like Mr. Trump is trying to force Democrats to negotiate on health care, and he's putting the burden on Congress to get something passed.
Obamacare is finished. It's dead. It's gone. It's no longer, you shouldn't even mention, it's gone. There is no such thing as Obamacare anymore. Sadly, the Democrats can't join us on that, which will be the long-term fix. But I do believe we'll have a short-term fix because I think the Democrats will be blamed for the mess. This is an Obamacare mess.
Joining me now is Democratic Senator Chris Coons of Delaware. Senator, welcome. Thank you for joining us.
Thank you, Katie.
So Donald Trump just there said he's heard a lot from Democrats about a short-term fix. What's realistic here?
Well, Katie, what would be helpful is if the president would actually get out of the way and allow the Senate to do its work. Both Senators Murray and Alexander, Democrat and Republican, who are the chair and ranking of the Health Committee here, were making progress towards a bipartisan compromise on strengthening the Affordable Care Act and extending affordable quality health insurance to more Americans. But that got shut down as Republicans tried one last time to repeal and replace Obamacare, which failed. The president saying in the clip that you just ran that Obamacare is dead, it's gone, isn't in fact true. Republicans have failed to repeal it. They don't have a real plan to replace it. And in the meantime, Democrats are very eager to find a way to work across the aisle with Republican senators to stabilize and advance the goal that we all have of more affordable, quality health care for more Americans.
Well, he's cutting off CSRs, which are subsidies to low-income Americans to help them pay for their health insurance. In effect, by doing that, is he trying to force Democrats to work with him and to negotiate on his terms?
Well, this is the same thing that he's doing in the Iran deal. He's sort of throwing a grenade in our lap and saying, here, toss this around for a while, and let's see if you can make something better with it. In my view, leadership would be coming to us and saying, I will accept any package that operates within this framework, rather than simply cutting it off, creating more chaos in insurance markets, raising rates for millions of Americans, and then hoping that maybe somehow Congress will fix the resulting mess.
Let me play devil's advocate here and say this. Congress has not come up with a legislative fix for the problems that are associated with Obamacare. Yes, a lot of them were exacerbated by the president's actions. Yes, that is true. Could this, I mean, if you haven't done it so far, is there an argument to be made for the president doing everything he can to ruin it, essentially, to force some sort of agreement to come out of it?
But, Katie, think about the human cost of what you're describing. Let's see if we can't cause more Americans to lose access to health care and see if their increased suffering, the loss of access to opioid and heroin treatment, the loss of access to mental health care, let's see if that human suffering inspires better action. I'll remind you, it's October. Republicans have been in control of the Congress since the beginning of the year, and for 8 months, they didn't hold any bipartisan hearings on how to address the Affordable Care Act. That only started after the dramatic failure of their attempts to repeal the Affordable Care Act in August. So in September, Senators Alexander and Murray began working in earnest. They had a series of very promising bipartisan hearings, and they made progress up until they had the cord pulled on them when they attempted to repeal the Affordable Care Act again last month. They've only had a few weeks of bipartisan work here to try and address some of the challenges and flaws with the Affordable Care Act. Given a few months, I do think we would get a strong bipartisan deal.
Good. given the fact, and you gave us a good reminder, which we gave at right before the commercial break as well, which is that there are people behind these policies. If people start losing their health care because it has become unaffordable for them, who is going to be at fault for that? Who is going to be held accountable for that? The president, Republicans, or the Democrats?
Well, I'll tell you what the CEO of the insurance company that provides the Affordable Care Act exchange insurance in Delaware told me. There's going to be a 30% increase in rates this year for those individuals who get their insurance through that marketplace. Half of that increase is because of the instability caused by not knowing what the president's going to do, whether he's going to continue to enforce the law, whether he might abruptly, as he just has done, pull back on these so-called CSR payments. So I think it's clear that the president's actions are destabilizing what was a fairly successful program to extend health insurance to 20 million Americans and to improve the quality of insurance for 150 million Americans who get their insurance through their employer. I frankly care less about who gets the blame than I do about who gets hurt. And who's going to get hurt is hundreds of millions of Americans.
Quick question on Iran. What is going to happen now with Congress? Are you going to vote to reinstate sanctions?
I truly hope we won't. I think the JCPOA, the Iran deal, is working to constrain Iran's nuclear program. There are lots of other things Iran is doing that are destabilizing, that are dangerous. We should be working in a bipartisan way and with our European partners to rein in Iran's ballistic missile program, to rein in Iran's destabilizing efforts in the region to support terrorism, and to impose punishing costs on Iran for its human rights violations. But we shouldn't blow up the part that's working in order to pursue a next deal that would address the ballistic missile program and other problems with Iran's aggressive behavior.
Senator, I know you have to vote, so we're going to let you go. Thanks so much for joining us.
Thank you, Katie.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.